Assalamu alaikum. Today's lecture is on the neurovasculature of anterior abdominal wall. We'll cover the cutaneous innervation of the anterior abdominal wall in this lecture and discuss the vasculature in the next lecture. The anterior abdominal wall gets its cutaneous innervations from the anterior rami of spinal nerve extending from T7 to L1. These nerve courses or runs between the internal oblique and transverse abdominis, supplying the skin and the parietal peritoneum. The nerves involved are the thoracoabdominal nerve extending from T7 to T11, the subcostal nerve, the T12, and the lumbar nerve L1, which later divides into two branches, iliohypogastric nerve and the ilioinguinal nerve. The clinical relevance for the innervation of parietal peritoneum is that these somatic innervations makes the parietal peritoneum sensitive to pain, temperature and pressure, and when irritated results in sharp localized pain, which is often termed as guarding or rigidity. Now let's have the look at the course of the thoracoabdominal nerve. The thoracoabdominal nerve originates from the thoracic neurovascular plane. These nerves run between the inner intercostal and the innermost intercostal muscle located within the intercostal space. The intercostal space is the area or the space between the two ribs. Within this intercostal space, you can see here the innermost intercostal muscle and the inner intercostal muscle. Between them is our neurovascular plane consisting of intercostal nerve, intercostal artery, and intercostal vein. The nerve T7 to T9 pierces the diaphragm. This is her diaphragm. This is the diaphragm. So, the nerve T7 to T10 pierces the diaphragm and extend behind the costal margin. This is our costal margin. Costal margin. So, the nerve from T7 to T9 pierces the diaphragm and extend behind costal margin, whereas T10 to T11 extend above the costal margin and pierces the diaphragm, extending into the internal oblique and transverse abdominis. These nerves then pierces the internal oblique, rectus abdominis, and the rectus sheath, which is formed by the aponeurosis of external oblique. These nerves, after come extending between the internal oblique and transverse abdominis, pierces the internal oblique. Then above it is the rectus abdominis muscle, and above it is the rectus sheath, which is formed by the aponeurosis of the external oblique and arises superficially giving off two branches, a lateral cutaneous branch and an anterior cutaneous branch. The lateral cutaneous branch supplies the lateral abdominal wall and the anterior cutaneous branch supplies the anterior abdominal wall. Now let's look at the course of the first lumbar vertebra. The first lumbar nerve. The first lumbar nerve arises from the lumbar plexus. The lumbar plexus, this is our lumbar plexus. Lumbar plexus, the psoas major muscle, and the quadratus lumborum muscle. So, the first lumbar vertebra L1 arises from the lumbar plexus and extend behind the psoas major and the quadratus lumborum muscle. And so the first lumbar nerve L1 arises from the lumbar plexus and extend behind the psoas major muscle and quadratus lumborum and courses forward, dividing into two branches, the ilio-hypogastric nerve and the ilio-inguinal nerve. The ilio-hypogastric nerve pierces the layers of anterior abdominal wall above the superficial inguinal ring and supplies the lower abdominal wall, whereas the ilio-inguinal nerve extends within the inguinal canal along the spermatic cord. This gray structure here is the spermatic cord. The ilio-inguinal nerve extends along the spermatic cord in the inguinal canal and supply our genitals. In male, it supplies the scrotum, and in female, it supplies the labia majora. The ilio-inguinal nerve also supplies the upper medial aspect of thigh. So the L1, the first lumbar nerve, arises from the lumbar plexus. It extend behind the psoas major muscle and quadratus lumborum and then courses forward, dividing into the ilio-hypogastric nerve and the ilio-inguinal nerve. The ilio-hypogastric nerve pierces the abdominal layers above the superficial inguinal ring and supplies the lower abdominal wall, whereas the ilio-inguinal nerve extends within in the inguinal canal along the spermatic cord in males and round ligament of uterus in females. So the ilio-inguinal nerve extends in the inguinal canal along the spermatic cord and the round ligament of uterus in female, supplying the genitalia. In males, it supplies the scrotum. In female, it supplies the labia majora, and it also supplies the upper medial aspect of thigh. So let's have a quick recap again about the neurovasculature of anterior abdominal wall. The cutaneous innervations were arising from the anterior rami-spinal nerve, which includes the T7 to L1 nerve running between internal oblique and transverse abdominis, supplying skin and parietal peritoneum. The clinical relevance of parietal peritoneum is that these somatic innervation make it sensitive to pain, temperature, and pressure, and when irritated, it results in sharp localized pain, which is often termed as guarding or rigidity. The nerve involves include the thoracoabdominal nerve T7 to L1, the subcostal nerve T12, and the lumbar nerve L1, which later divides into two, the ilio-hypogastric nerve and the ilio-inguinal nerve. Looking at the course of the thoracoabdominal nerves arises from the thoracic neurovascular plane, which is located between the innermost intercostal and the inner intercostal muscle, which is present within the intercostal space. The intercostal space is the space between the two ribs. Now, looking at the course of the nerves, the T7 to T9 passes the diaphragm behind the costal margin and extends into the between the transverse abdominis, internal oblique, and transverse abdominis, whereas T10 to and T11 passes the diaphragm above the costal margin and extend between the internal oblique and transverse abdominis. L1 nerve running between internal oblique and transverse abdominis, supplying skin and parietal peritoneum. The clinical relevance of parietal peritoneum is that the somatic innervation makes it sensitive to pain, temperature, and pressure, and when irritated, it results in sharp localized pain, which is often termed as guarding or rigidity. The nerve involves include the thoracoabdominal nerve T7 to L1, the subcostal nerve T12, and the lumbar nerve L1, which later divides into two, the iliohypogastric nerve and the ilioinguinal nerve. Looking at the course of the thoracoabdominal nerves, the thoracoabdominal nerves arises from the thoracic neurovascular plane, which is located between the innermost intercostal and the inner intercostal muscle, which is present within the intercostal space. The intercostal space is the space between the two ribs. Now, looking at the course of the nerves, the T7 to T9 passes the diaphragm behind the costal margin and extends into the between the transverse abdominis, internal oblique, and transverse abdominis, whereas T10 and T11 passes the diaphragm above the costal margin and extend between the internal oblique and transverse abdominis. These nerve then pierces internal oblique, rectus abdominis, rectus shield, which is formed by the aponeurosis of external oblique and arises superficially, dividing into two branches, lateral cutaneous branch and an anterior cutaneous branch. The lateral cutaneous branch supplies the lateral abdominal wall and the anterior cutaneous branch supplies the anterior abdominal wall. Now moving on to the course of the lumbar nerve, which arises from the lumbar plexus. The L1 arises from the lumbar plexus. The L1 extends behind the psoas major and quadratus lumborum and then courses forward, dividing into the iliohypogastric nerve and the ilioinguinal nerve. The iliohypogastric supplies the lower abdominal wall and the ilioinguinal nerve extend within the inguinal canal along the spermatic cord and round ligament of uterus and supplies the genitalia in males scrotum and in females labia majora. It also supplies the upper medial aspect of thigh. Now let's talk about the concept of the dermatome. The dermatomes are the areas of skin that are supplied by a single spinal nerve. There are many dermatomes located within the anterior abdominal wall, but the three most important dermatomes are T7, T10, and the L1. T7 at xiphoid process, T10 at umbilicus, and L1 at the pubic region. As you can see here in the Med Climber notes, the cutaneous innervations, dermatomes of the anterior abdominal wall. There are many dermatomes present throughout the anterior abdominal wall, but the three most important of them are T7 located at the xiphoid process. Here is your dermatome number T7, T10 at umbilicus. This is your dermatome number 10, and L1 the pubic region. This is your L1 the pubic region, T10 at the umbilicus, and T7 at the xiphoid process. The significance of these dermatomes is that they help to locate the structures present behind them. Another point is that what is rectus sheath block? It is the rectus sheath block. It is a local anesthetic injection given to block the nerve T7 to T12. This is known as the rectus sheath block. And I would like to add another point, that is the pyramidalis muscle muscle, which is an accessory muscle located behind the rectus sheath, is supplied by the subcostal nerve, that is T12. So that conclude our lecture on the cutaneous innervations of the anterior abdominal wall. In the next lecture, we'll discuss the vasculature of the anterior abdominal wall.